Hi everyone, it's Dr. Pham again. Today we're going to talk about postoperative circumcision care. Another educational video is brought to you by Urology.com. Before we talk about circumcision and how to care for it, let's just briefly go over an uncircumcised penis. So in an uncircumcised penis, all children are going to be born like this. You have the penis, and then you have the scrotum, and in the scrotum you have two testicles, and then you have the glans penis. Now in an uncircumcised penis you have the foreskin that kind of covers this, and this foreskin every child is born with. That is something that we call physiologic phimosis. In a circumcision there's multiple devices that are used. The device I typically use is the safest because it prevents injury to the glans penis. And the device I use is something called the Gomco clamp. And what the Gomco clamp does is it's a device that shapes something along this line. And they come in various sizes depending on the head of the penis. And what it is I make a slit down the foreskin. And then once the foreskin is slit, then I take the foreskin down, and then we put the Gomco device on the penis itself. So once we put the Gomco device, what it does is it covers the head of the penis. And then there's a little device that attaches to this that looks something along the line like this. And what that does is the device attaches to that and it clamps down the skin. And how newborn circumcision works is there's an inner skin called the interpupillar skin, and then the outer skin, which is what we call the penile skin. What the Gomco device does is it clamps those two skin together. Hence, by doing that, we don't have to use stitches. Now, sometimes I do put something called dermabond, or basically human super glue, around the incision right here to help with bleeding. Typically, it takes about 7 days for the dermabond to disappear. However, if you put Vaseline on it, it can disrupt the dermabond and cause it to disappear early. So what I recommend parents do is instead of applying Vaseline directly on the glans penis or the head of the penis itself, to apply the Vaseline to the diaper. And then when you put the diaper on, it will prevent the penis from sticking to the diaper without actually having the Vaseline on the dermabond itself. Now, even if the dermabond falls off early, that's okay. As long as there's no bleeding, that's not an issue. Now, sometimes you can have spotting, and that usually will resolve itself. Typically, it won't require a stitch or anything dramatic like that. I do more than 1,000 circumcisions a year, and I do about 120 circumcisions a month. And less than 1% do we run into trouble. And what are trouble? Really, is just bleeding. Because of the type of the device we use, it's very rare that you will get injury to any part of the penis. Once in a blue moon, I do put a dissolvable stitch if I can't stop the bleeding. And that won't leave any long-term consequences. Now, after about 2 weeks, when everything's healed, it heals in about a week, but after about 2 weeks when everything is healed, the baby will start to gain weight. And when the baby gains weight, what ends up happening is what we call the prepubic foreskin, something like that, can push the skin over the head of the penis. Now, what I recommend my patients do is once a day during bath time, just make sure you pull the foreskin down, which is this. Make sure that you do pull it down so that it doesn't stick to the head of the penis. Because if this foreskin sticks to the head of the penis, it can form something called penile skin bridges. Well, with penile skin bridges, I have to numb the child up in the clinic and then take it down using scissors. I prefer not to do that. However, if up to a month, if we just pull it down once a day so that you see a penis that looks like this every day, then you will have no issues. And I usually tell parents to do it around bath time is because they can remember it. Now, any circumcisions that I do, I always see them back now in 6 weeks to make sure that you do have the perfect penis. Because if I find something that is not right, typically, if I see them early, these are stuff that I can take care of in the clinic. If you have any questions and you're not sure if it looks right and it's not the 6-week follow-up, what I suggest you do is go to phamurology.com, and there's a portal that says Current Patient Portal. Once you go on that portal, enter your child's name, and it gives you the option of taking a picture to see if that's normal. If it's not normal, my office will call you and schedule an appointment sooner than 6 weeks to make sure that everything looks good. Because it's better if I see it early than it's a problem I can fix. And that's pretty much easy. That's pretty much it on how you take care of the penis. If you guys have any other questions specific to this, you can also go on the Current Patient Portal and send me a message, and I can answer it for you guys. Okay? Well, I hope this video helps. If it does, please subscribe to it. And please give us a good review on Google. All of this is done through charitable donation. So by subscribing, some of that funding will help us put up videos to help you with urologic issues. Once again, this is Dr. Pham. Thank you for watching.